After dealing with the endogenous catecholamines, let's now target the other agonists. Particularly for now, let's target the alpha agonists. We can subdivide them first into alpha 1 selective and alpha 2 selective agonists. And of course, since alpha 1 and 2 receptors have different effects, you would suspect that these two have different uses as well. So for the alpha 1 agonists, we have phenylephrine, which is a solid drug of its chemical class, and the imidazolines, which include the following. And then alpha 2 agonists are the guanidines, which include the following. When we discuss this in medicinal chemistry, will you go as far as drawing what the imidazoline ring looks like, or what again is the guanidine functional group? But for the purpose of our discussion right now, this is helpful as far as letting us remember that the suffix zoline is very evident in these examples. And for our guanidines, it's either an ending or a suffix of nidine or a prefix of guan. Makes it easier, right? Now, let's go to the effects. Good thing is that alpha 1 agonists and alpha 2 agonists have very common things that they do, and also the uses. For example, phenylephrine and imidazolines, all of them cause vasoconstriction because, well, that's what activation of alpha 1 does. But the context of their usage is slightly different. Phenylephrine is more of used as a decongestant. So what does this have a connection with this effect? Well, it is said that nasal congestion, the feeling like you can't breathe through your nose, is mediated or caused by vasodilation. So like you cannot have a straight flow of air. So in order to counteract that vasodilation, then perform vasoconstriction. This is why the decongestant effect is observed with phenylephrine. And this, in fact, is a very popular component of many cough and cold preparations across the globe. For the imidazolines instead, we have drugs like nafazoline, silometazoline, tetrahydrozoline, especially tetrahydrozoline. These are used in the context of sore eyes. Almost forgot the term. So in sore eyes, we should remember or imagine there's redness, right? And there's heat. The redness here is also caused by vasodilation. I mean, the reason why there's redness is because there is more blood being seen through the eye, and more blood can only be seen through the eye in the context of having dilated vessels behind it. So if I counteract that via this effect, then I can deal with this. So we have a lot of eye drops. I won't mention brands again. You probably know some popular ones that have these, especially tetrahydrozoline. Those with red caps most of the time, this is the guy. Now, for the alpha 2 agonists or the guanidines, we have clonidine, brimonidine, apraclonidine, guanabens, and guanfacine. Good news, these all can be used in lowering blood pressure. Why? Because if you activate alpha 2 receptors, you will cause vasodilation, and that will reduce blood pressure. So it's as if we're saying that these are antihypertensives. And that is really the case with clonidine. It's widely recognized, although not anymore near being a first-line drug in the modern day, it's still used as an antihypertensive. Additionally, brimonidine and apraclonidine are clonidine derivatives or relatives that are used for glaucoma. One effect that I will only be mentioning right now is that activation of alpha 2 will actually reduce the production of aqueous humor. Okay? Which is not so obvious, but if you go back to the table of sympathetic, it is indicated there that activating this one will lower tears, but it's kind of hiding, right? So I really need to mention it outright. But yes, that's what they do. And by reducing aqueous humor, you reduce the intraocular pressure, which is the problem in glaucoma. Okay. Now, what are the problems that we can encounter with these alpha agonists? Well, let's try to analyze. First, with alpha 1. Well, what else do you expect to happen if you over vasoconstrict? Since I did mention a while ago that vasodilation decreases blood pressure, then obviously vasoconstriction will increase blood pressure. And if that is the case, then you might actually elicit some kind of hypertension, right? That's the problem in alpha 1. You can cause artificial hypertension if you give way too much of this. So for example, you have a cold and you're taking phenylephrine or a cough prep. It is expected that your blood pressure reading will be higher than normal. So it's not a wise idea to check your BP during that time because it may be inaccurate. Now, for the alpha 2 agonists, it's very important to note that these alpha 2 agonists act centrally. I mentioned this in one of the previous videos that in order to cause a vasodilatory effect, it must act presynaptically. And that means that you are targeting the receptors near the brain. However, if you do that, then you might actually target other things in the central nervous system and cause central effects like sedation and depression. And indeed, these are the problems of people taking clonidine. That is a reason why clonidine is far from being a first line, because these may prove troublesome. These are the things to talk about the alpha agonist. But now let's go to the beta side this time. So we have beta non-selective. So this is still selective for beta, but non-selective in the context of still targeting both subtypes. But if you really want to go all out selective, we have beta 1 selective agonists and beta 2 selective agonists. And these are the representatives. For beta non-selective, the one and only example always mentioned is isoproterenol, also known as isoprenaline. I just remember that right now. For beta 1 agonist, the shining star of most books is the butamine, not to confuse with dopamine, okay? And beta 2 agonists are just a lot, and these are some of the popular ones. Salbutamol, also known as albuterol, which is arguably the most popular of the group. Formoterol, indacaterol, terbutaline, ritodrine, and isoxazoline. Unfortunately, unlike the alpha agonists, the suffixes here may not be uniform. So you may really need to memorize them. But the effects are kind of easy to understand anyway. For example, for beta non-selective drugs like isoproterenol, since you're hitting both, then you will get all of these effects. However, in practice, the one that isoproterenol is used for is this part. So you can use isoproterenol for cases related to the heart. For example, heart failure. And the butamine is also used similarly since after all, beta 1 activation will focus also on the heart. In fact, dopamine is very popular as a positive inotropic drug. This is why I also mentioned that you should be careful with dopamine and dobutamine because guess what? If you watch my discussion on dopamine previously, medium dose dopamine also serves as a positive inotropic. So similar effect, then they almost sound similar, dobutamine, dopamine, so be careful. Then for the beta 2 agonist, we focus more on the lungs and the uterus. This is why a good majority of them, for example, among these choices, these 4 from salbutamol to terbutaline, can be used for asthma. Bronchodilation, is beneficial for asthmatic patients, right? But additionally, terbutaline, ritodrine, and isoxazoline can actually cause uterine relaxation and give a tocolytic effect, which is a technical term for a drug or a substance that prevents premature delivery of a baby because it relaxes the uterus, so it prevents the baby from going out. Okay. When you do discuss respiratory drugs, this will be even discussed more because among the beta 2 agonists, we have short-acting and long-acting ones. But for now, I think I will not mention which of these are the short or the long-acting ones. Now, what are the problems that we can encounter with beta agonists? Well, first of all, anything that will target the beta 1 will cause positive chronotropic and positive inotropic effect, right? Well, in that case, what we could get is tachycardia. So this applies to beta, non-selective, and beta-1 agonists. Okay. And of course, tachycardia may not be a good feeling because, for example, you're sitting down and then your heartbeat is excessively fast, but you're not doing exercise. It may prove to be irritating at the least and tiring at most. Okay. And then for beta 2 agonists, luckily, there's not a lot of problems there because we don't really face a lot of consequences with this. By the way, just because it's mentioned that beta 2 agonists are selective for beta 2, it doesn't mean that they don't target beta 1. If you give too much of the dose of beta 2 agonists, they will eventually overflow and hit beta 1 receptors. So this is like saying that beta 2 receptors in very high doses may also elicit tachycardia. Now, here we have one more class. But you might ask, hey, we already discussed alpha 1 to beta 2. We're done, right? Unfortunately, not all of our adrenergic drugs are direct acting. We have indirect acting ones, right? In the form of what we call reuptake inhibitors. And so let's go through some of those reuptake inhibitors. So again, we can have indirect acting ones, which really are exclusively inhibitors here. And then we have what we call quote unquote mixed agonists, wherein they have some of this effect, but also some of this effect. So mixed being sometimes direct, sometimes indirect. Some of these examples may be very popular. How many of these you have heard of before? And these have very unique uses. Oh, by the way, look at my table here. We already disregarded all receptors, right? Because when you do say indirect acting, you're not targeting a specific receptor. This time, you're targeting the transporters for reuptake. So, for example, amphetamine, despite actually being having a bad reputation, because for example, the methylated version is a popular drug of abuse. Amphetamine can be used for ADHD. The mechanism by which we cannot anymore discuss, but yes, this can be used for the ADHD. And speaking of, methylphenidate also is used for that. In fact, this is one of the most popular, if not the single most popular drug for patients with ADHD. So much so that its brand name is the basis for the name of the metabolite of this one. But again, I don't want to mention the brand. Cocaine is another very popular drug of abuse. So you can probably suspect that this is not anymore used in the modern day because you'll probably go to prison if someone catches you with this. But it was a local anesthetic. And we will be discussing local anesthetics in the future. Okay. Sibutramine is one of the appetite suppressants having adrenergic effect. And if your appetite is suppressed, then you won't eat. So this will cause weight loss. So this is for people who want to lose weight. For mixed agonists, we have ephedrine and phenylpropanolamine. Abbreviation of phenylpropanolamine is PPA. Good thing, both of them have the same use, and they are used as decongestants. Similar to phenylephrine. Well, after all, if it's a reuptake blocker and it elicits all of these effects, then eventually it will hit alpha 1, right, and cause that decongestant effect by virtue of the increased neurotransmitters. So now, what are the adverse effects or side effects? Well, number one is the potential for addiction. Though not anymore within the scope of ANS, there are just things about amphetamine derivatives and cocaine that really alter the brain's function. But other than addiction, another physiologic effect that is really overlooked when discussing these is the increase in blood pressure. After all, if you are causing a general increase in activity of all these receptors, this increases blood pressure. This also increases blood pressure. And you know what happened to some people who overdosed on some of these? Stroke. Okay? So that is why, for example, people who were taking sibutramine to lose weight, some of them suffered stroke. It was not a wise idea to lose weight at the expense of being paralyzed for a moment. Okay. And this is also a reason why the increase in BP, just like what I said with phenylephrine before, you cannot take your blood pressure, or maybe you can at your own risk, after taking cold preps with these, because the pressure level may be inaccurate, it may be too high. Additionally, do you know that one of the isomers of ephedrine, particularly pseudoephedrine, was used as a precursor for the synthesis of some drugs of abuse, for example, amphetamines. So, of course, that also led to ephedrine being either restricted or being outright banned in some countries, despite it being just a mere decongestant. And these are all the agonists that we will talk about.